Adams County, Lancaster County, York County delegations have been always in the forefront of changing funding formulas because we're growing counties. We have similar interests. We're right along the border, contiguous with each other. We have a close working relationship, and looking at funding formulas and issues with MHMR and the fact that per capita, out of all the state funding formulas, literally we are the bottom feeders. We have the lowest amount per capita. When you have growing populations, you have greater needs, especially MHMR and intellectual disabilities, where at one time these people were put into institutions. Court cases have said we have to do community-based services, and we're still not ready for the amount of people that we see in community-based systems with MHMR funding. So this is a good starting point to say we're going to reallocate spent funds. These are some big increases. This is real money to help real people at the local level deal with some significant issues. MHMR is a serious issue. I have constituents, more and more it seems, that have problems getting assistance with their loved ones. How do I help them? How do I go through the system? At the same time, we need help in the local community to deal with these. So it's great for community, it's great for counties, and most importantly, it sets up a way to start changing these funding formulas, which we have been animate on. We've supported changing them, and now we have a mechanism to do it. The changes we made in Act 87 are a great starting point for changing the egregious funding we've seen in the past for counties, for school districts, et cetera. But it's only a starting point. We have legislation that Will Tallman is authoring and taking leadership on that we need to get done to ensure that funding stays codified in law to make sure our communities get a fair shake in dollars being spent in Harrisburg.